right. Dr. Courtney Hays, thank you so much for being here with me today. I'm so excited to talk with you.
Me too.
So first, I'd love to hear, what do you do? You're a doctor of chiropractic, but that can be different for so many different things. So what is your specialty? What do you like to do?
Yeah. So I am a trained doctor of chiropractic, but my practice and the people that I focus on working with are all mostly women in like the perinatal phase. So whether they're trying to conceive, they're pregnant, or they're postpartum, or they're just trying to work through some type of injury at any point or any point along that trajectory, that's what I focus on. So my training is a mesh of chiropractic and physical therapy. So I, of course, went to school to become a doctor of chiropractic. I'm very proficient in being able to do adjustments to the spine and the extremities, but I've also incorporated some other techniques, soft tissue techniques, movement rehabilitation techniques in order to help support the adjustments. And I find much better results with that.
Amazing.
That's my
That's so
approach.
important, right? Because we're not just bones, right? We're
Yes.
all these other muscles and tissues too. So
Yeah,
that makes sense to work with all of it together. Yeah.
when I was in school, I was like, okay, this is great. I feel so good after I get an adjustment, but then why do I have to keep getting the same adjustment over and over? Or why is the same region always bothering me? And that's when I really started to dig a little deeper and find some other ways to help support my patients to be able to not have to go to their chiropractor every week for the rest of their life. So
Mhm.
that's really what it stemmed in is I just wanted more. I was like, there's more to this picture. There's other pieces to this puzzle that I want to be able to help solve. So that's what just guided me to start training in some other things that I mesh together now.
Amazing. I love
Mhm.
that. Again,
Yeah.
it makes sense, right? It makes such sense to me, and especially working with women in this very unique place in their life where their body is changing very drastically. It's great to have that special lens for those bodies.
Yeah, that's a
Thing.
good way of putting it.
Yeah. And what inspired you specifically to get into women's health and perinatal health?
So I would say it stemmed from personal experiences or experiences that were less than ideal dealing with my own health. I graduated from chiropractic school. That was a very strenuous process, getting out into practice and just working a lot. And I started having my own challenges with my menstrual cycle and back pain, hip pain, things like that. And so I just started doing my own research, reaching out to doctors, being failed by doctors, finding doctors that were able to help me. And so it just really changed, like you said, changed my lens with how I was now evaluating musculoskeletal pain with my patients and how that can relate to more than just your muscles and your bones and your ligaments. I took that and just kept going down the rabbit hole. And as practice went on and as the years went by, I got pregnant. I had my first baby. I had to rehab during my postpartum. And so all of those experiences with my first and then my second child, it just really kept and continues to open my eyes to different things. And for example, women's bodies are designed differently from a physiological standpoint. There's a lot more prevalence of certain challenges, let's say hypermobility, for example. Like people who come to the chiropractor often want to have their back adjusted or their back cracked. But there are instances where that will actually make somebody feel worse. And in many times that's women because we have more mobility in our ligaments and in our pelvis, especially at different phases of pregnancy or different phases of your menstrual cycle. And so taking all these variables into consideration when you're developing a treatment protocol for somebody or where you're deciding like what is the first thing that we should address when we're trying to manage back pain or hip pain or things like that. So just really taking a whole body approach and a whole system approach and acknowledging too, this is within my wheelhouse and this is not within my wheelhouse.
Mhm.
This is where I would love to co-manage with acupuncture or functional medicine or pelvic floor PT. Just having the ability to know like that I'm going to be able to help with certain things and there's certain things that I'm not going to be able to help with and being able to refer somebody to the right person, I think is huge with women's health, with musculoskeletal health. It's just all very complex and there's a lot of nuances and variables that require extra thought and extra questioning and extra history taking when you're going to go to help somebody. So
Yeah.
my initial assessments are an hour long and like half at least 20 to 30 minutes of that on top of the intake paperwork is, let's talk about how your first birth went, for example. Tell me about how you felt during your pregnancy, after your pregnancy. Have you ever been on hormonal birth control? Are you taking supplements? There's just so many questions and so many variables that need to be considered when you're dealing with musculoskeletal pain, which is what my specialty is.
Yeah. Awesome. You said so many incredible things there, but I completely agree as far as being part of a team. I think there's so much value in knowing your limits and your
Yeah,
boundaries, right? If this is my area of specialty, and if it's not, if another thing is not my area of specialty, here's the person that I can send you to cover that area. And I really think there's so many people that were complex, like you said. We need a team. It's very rare that one person can get where they want to be with just one single person. Having a team and knowing what those options are and what's really going to work best for our body, I think is important. Yeah.
it is. And one of the beauties and also the not so beautiful things of chiropractic is that depending on the provider you go to, you can have a completely different experience. So, like, our licensure and our training has such a wide, vast, overarching ability to practice so many different techniques. And
Mhm.
so, you want to make sure that you're finding a provider that is offering a technique that works for you and your body. And that may look different for everybody. I wouldn't write off chiropractic in general just because you potentially had one negative experience. You want to look for somebody who has some of the skill set and the techniques that you think might work for you, or that your doctor referred you to that might work for you. There's so many different things that we can practice as chiropractors, but that doesn't always mean that they're all going to be effective or for your body at that time.
Absolutely. Yeah. And it's one of the things I wanted to ask you about is what is chiropractic really, and how is it different the way that you practice it? And I think you answered that it is so different. And if you want to elaborate on that too.
Sure.
Yeah.
Yeah. So chiropractic, becoming a doctor of chiropractic is basically a specialist in musculoskeletal pain and dysfunction. So our primary intervention is what's called an adjustment, and that is the stereotypical like crack and pop your back type of thing. It's much more than just that. The sound of the crack is actually not what's therapeutic. It's what's happening within the joint that you're adjusting. So we're identifying regions of the spine or the arms and legs, extremities, where the joints are not moving appropriately. So there's a restriction in their range of motion, which can also cause interruptions in the nerve flow in that area, blood flow in that area. And so that's a primary thing that we're trained in. But as we all know, pain can manifest from many different sources. And so if it's a musculoskeletal in origin, you have a sore muscle or you have a nerve that's irritated or you have a disc herniation, things like that, those are all within the chiropractic wheelhouse to be able to treat. We have a lot of very effective ways to treat those types of things. But when we get into other circumstances where perhaps we do some chiropractic treatment and we're not seeing the results that we would expect, that's when we're going to have to start to refer out and dig deeper. And that's where I find many chiropractors go wrong, is they just keep doing the adjustments, keep telling their patients it takes time, it takes time. And it's there, yes, there is an essence, like a time period that you want to allow your body to heal and see if you can benefit from chiropractic, but it shouldn't be 6 months, 9 months, 1 year. Should be seeing those results within the first month or so. So yeah, hopefully that answers a little bit more about what chiropractic is.
Yeah, that was really helpful because I think, again, if someone is trying to find a chiropractor in their area and, even in the first visit, maybe they can get a feel then if this practitioner right for me or not by what is the intake process looking like? What questions are they asking?
Yeah.
Is it like, okay, you have to work with me for the next 6 months no matter what? Or
Red flag.
yeah, that I would feel like that would be a red flag where they're just like, trying to get you through. And I've had some mixed experience personally with chiropractic. I had neck problems a while ago and went to a chiropractor, and it wasn't a bad experience, but also wasn't like a sensational experience.
Yeah.
Okay, yeah, I was cracking my back. He took some x-rays. Nothing was really getting better or like remarkably better. And so I went a different direction. Of course, now I'm an osteopathic doctor too. So that I would like have gone to osteopaths too, which is very similar. And I actually, as an osteopath, I really appreciate what you're talking about with the musculoskeletal system and looking at all of it together, because we know that like hormones impact our muscles and the laxity of ligaments, and there are so many different aspects. So I appreciate that you're really putting that all together and taking all of that into account when you're treating people.
Yeah. Yeah. And I think that's important too, even just when you're managing, let's say, a shoulder issue from a patient perspective, not to just worry just about your shoulder. Like, we want to look at other areas of the body that contribute to how the shoulder moves and how the shoulder could be hurting. So having a little bit of an open mind too, of recognizing that, oh, my shoulder hurts, but my shoulder is connected to my shoulder blade, and my shoulder blade goes on top of my rib cage, and my rib cage attaches to my spine. So there's all these regions that can be worked on to help with, let's say, one site of pain. There's so much that can be worked on that can have a positive impact on that one region of concern.
Yeah.
Yeah.
Awesome. I love that. What is, to maybe go a little bit deeper into like women's health, like how does musculoskeletal pain and the female, like specific female anatomy, maybe their like reproductive system, where is the connection there?
Yeah. So the number one thing that always comes to mind when I think about that is that most people don't know is that your uterus attaches to your sacrum in the back of your pelvis by one strong ligament on either side called the uterosacral ligament. And so this ligament can be very profound because not only can it be related to pain you may be having in your back, perhaps related to your menstrual cycle, related to pregnancy, but by working on the sacrum, you can actually have positive effects onto the uterus. So it works both ways. So that's just one example of that connection between musculoskeletal pain and our female reproductive organs. But I would say, like, over my years of practice, there are a lot of overlapping areas where it could be something more female reproductive versus just musculoskeletal. So let's say, for example, you're having like pain in the lower quadrant of your abdomen on one side. You could think it might be your hip, it might be your hip flexor, it might be your abdominal muscles, it might be your pubic bone on one side. If you're working on that, let's say with physical therapy or chiropractic, and it's not improving, then what else could that be? You could have a cyst, we could have a fibroid, there could be some type of digestive challenges, depending on which side you're feeling it. So just being able to have a more detailed and thoughtful approach to treating it. I look at it as like a hit list. So I do the assessment, like, it's looking like a hip issue to me. So let's treat this and you're going to work on this and this at home, and we'll give it a couple weeks and see how it's feeling. If it's not improving, then we can try this other method. And then if that's not improving, then, we're going to refer you out to get the cyst or the fibroid ruled out from an imaging standpoint, ultrasound, CT, MRI, whatever it needs to be. Just having that mindfulness of, okay, so there's pain in this region, and what are the top things that could be causing that? I think that's really important. And then also just I find a lot of women are hypermobile, and in many cases, they may come to the chiropractor thinking that they need their back to be adjusted or their pelvis to be adjusted, but what they actually need is more stability in the area. So we need more stability through our core in order to help support the structures of our spine, our lower back, and our pelvis. And so I've had a handful of people, even in the last couple of weeks, where they're so used to getting their back cracked and they feel a temporary relief, but they're still having the same problem, and they're coming to me wanting another opinion. And so I'm like, you know what? We're not going to do that. We're not going to crack your back. I know it feels like it needs to, but you actually need stability in the area. And like the changes that you can see by actually working more on muscular control and stabilization and breathing and all these things that surround the pelvis and surround the abdomen, where all of our reproductive organs are, can have a really profound effect.
Awesome. I appreciate you bringing that up. And I think that's so cool that you take that approach. For one, like you were saying, walking through the hit list, right? I always do that in my brain too. Okay, what's in that area? What could it be?
Yeah.
That it's amazing that you're not just, I don't want to say closed-minded because it sounds so negative, but I feel like so many specialists are like, nope, this is my area. It's just the hip bones. Like it's just an orthopedist, for example. Nope, we're just looking at the hip. And rather than having a conversation about, oh, it could be, like you said, a fibroid or cyst, usually they're just like, oh, it's like end of conversation. There's
story. Like there's nothing else that could
I just have nothing to say about that. Yeah. Instead, even like you were saying earlier, even if it's outside of your wheelhouse, you can say, okay, I think now is the time to explore these other possibilities and discuss that with your patient rather than just.
Yeah. I think this all goes along the lines of the lack of listening to women when it comes to their health, and like the gaslighting and medical, like how that happens just so commonly to women. Like I just had a patient who was having a hip, literally what we're talking about, hip issue. She's had it for a long time. She was a dancer. She does a lot of yoga. She's having all this hip pain, but she's like 41. And so her doctor's, your hip's fine. And she's, but my hip's not fine. And so we're talking about what the options are of what we can do for treatment and, what orthopedic doctor may be able to offer to her and what they can't offer to her. And she was like, I knew it started in the hip, then it went to the back, and now it's back in the hip. And I knew it was my hip all along, but the doctor was trying to tell me it was my back or it was this. And I'm like, you knew, like your intuition knew, your body was telling you, and you weren't being listened to, and you weren't being provided the options for treatment that should have been provided to you. And that makes me sad. And that's why I'm so passionate about what I do, because I hear these stories all the time and I'm like, you knew it was going wrong. You just didn't know how to fix it. You just didn't know how to treat it. And that's where someone like me can come in to help. I'm sure your patients do the same thing. They're like, something feels off. I think it's this. And oftentimes they're right.
Yeah. Every single day.
Yeah.
That is basically my business, because unfortunately, and it's not to say that every doctor is like this, right? Because there are amazing doctors out there who are maybe in a certain specialty that could get a bad rap, and they are going the extra mile and trying to really help their patients however they can.
Yeah.
But so commonly, it's a big system issue. It's not even just the doctors. This whole system is pushing shorter visits and whatever. And so it is such a common problem. And yes, so many people come to me also with the same story. I knew something was wrong, but they told me all my labs were fine. That's it. And so they did 2 labs. So that's why they didn't know.
They didn't get it.
Sometimes even that is, it wasn't even ideal. So what are they talking about?
Yeah, they didn't look at the full picture.
Yeah.
Yeah, I see that a lot. It's, oh, I went to PT and they gave me these exercises but I don't feel any better. And I'm like, those are great exercises, but let me see how you're doing them. And they're not doing them right, or they're not feeling the right muscles work when they're doing them, and so it's crap. Like all this time you've been doing all this and it just you weren't getting the therapeutic benefit that you needed to out of that exercise.
Yeah.
And just taking the time to actually get to the bottom of that and to talk, what muscles are you feeling? Or what exercise did they give you and what combination? What lab work did you get done? Oh, they tested your thyroid. Okay, but what things did they test? Did they test 2 things or did they test 8 things?
Yeah.
Yeah, getting that information is so crucial.
It is. Yeah. And even if we're limited with what we can do, having the bigger picture, just like the mindset to not put our ego in front of just trying to help someone and say, I have no idea. Even if it's, I have no idea, at least you're saying to them, let's look somewhere else. And usually we're not saying that, and we have some idea of what else they could try. But at least having that understanding of the big picture and really trying to bring people back to that.
So important.
Yeah. I'd love to hear specifically, since you specialize in the perinatal time frame, before pregnancy, during, after. I'd love to hear maybe some specifics of, maybe let's start with before pregnancy, how you support people. And I'm sure it's different for each individual, but are there certain general things that maybe you're looking at or focusing on?
For sure. So before pregnancy, we just want to make sure that you're feeling your best. Pain can be very exhausting. It can be very stressful on the system. And so if you're having daily pain or an area that's really been bothersome to you for a long period of time, or even just a new injury, it's best to try to get that taken care of before pregnancy. So let's say, for example, you've had back pain on and off for quite some time, and you know that you're hoping to get pregnant. And we all know during pregnancy, it is very common to have lower back pain. It's not normal, but it's common. And so if we can get ahead of that and start to address any imbalances, asymmetries, weaknesses before pregnancy comes upon you, then your likelihood of having a more smooth, less painful pregnancy goes up. You can't always prevent everything, of course, but just really taking the time to check in with your body and make sure that you're feeling your best in your lower back, in your hips, things like that can be very important. Another thing I see a lot pre-pregnancy with people experiencing a lot of stress is like headaches, tension headaches, neck pain, and the upper trapezius area here. It's a really common thing that is very easily treated with chiropractic adjustments and chiropractic care. So that would be another thing I would say to keep an eye on pre-pregnancy.
That makes sense. If something is not in the optimal position, or there's something that could be done to get everything more in balance
Yeah.
before
Yeah.
pregnancy. That makes such sense because you're right. It isn't normal maybe to have certain pains, but it's very common as things stretch out, as our belly gets bigger. So that's
Yeah.
great to prep your body for the physical changes.
Totally. And we're not allowed to advertise this through our scope of practice. There is a deep connection between the nerves of your spine and your sacrum and your uterus and your female reproductive organs. So if there
Mhm.
is some type of nerve interruption or nerve compression going on, then that could be impacting your body's natural ability to send the right signals to that area. So getting your back, your lower back and your pelvis adjusted can help with that, which then in turn could help with conception. So it's not something we're allowed to advertise that we can do, but it's not out of the ordinary and it's not out of our scope to be able to help with that area.
Yeah, that makes sense.
Yeah.
Especially we know the autonomic nervous system is so important for reproductive organs. That's our fight or flight versus rest, digest, reproduce. And so
Yes.
even that working on the head and neck can absolutely impact that balance there. And then also, I was actually even just reading a study recently about it was pelvic manipulation, more the soft tissue manipulation, but just
Uh-huh.
doing things like in better positioning and getting
Yeah.
blood flow there can
Yes.
have a huge impact. And it's hard because you're right, like there's no, or there aren't very many studies to back that
No.
up. And so it's hard, like you can't state that maybe. But there are these things that happen. And I feel like these are the ones that I see the most in this like unexplained infertility category where
Right.
they're not getting a specific diagnosis of, oh, you have poor blood flow to your uterus or something like that, but it can impact that. So it's like the getting into the nitty gritty of, okay, what are all the aspects that are so important to our reproduction?
Yeah. Yeah. I would just look at it as like optimization. Like you said, there's no money in the research in this, unfortunately. So
Mhm.
there's only anecdotal stories that we can share and pass along. And I literally just had somebody that on Saturday come in and she unexplained infertility. She's been going through IVF and all the other things, acupuncture and all this stuff. And she'd never tried chiropractic and her mom suggested it. And coincidence or not, but her last transfer just was successful and she had just been in my care for a couple of weeks prior to that. So it happens.
It happens. Yeah. And
Yeah.
especially like, I feel like too, like you said, coincidence or not, it's so hard in fertility care that
Yeah.
we can't say exactly what the thing was that did it.
Yeah.
But I agree when I see someone who has a team approach, they're really well supported, they're addressing all the aspects and working on their nervous system, working on their physical health in so many different ways. It definitely can be the final piece that
Totally.
that's
Yeah. Yeah. Like even like the nervous system relaxation that happens after an adjustment can be super profound. Everybody feels it or experiences it a little bit differently, but that is one of the benefits of an adjustment is a reflexive relaxation of the surrounding tissues and nerves. Even if you're not somebody that's traditionally had a lot of pain per se, but you're feeling really stressed, you're feeling really anxious, and you're open to trying something else to help calm that down, it can be a great option.
yeah.
Yeah.
How about during pregnancy, like how you support women? I know you specialize in the Webster technique as well, and I'd love to learn about what that is
Yeah.
and what else you do. Yeah.
Sure. Yeah. So during pregnancy, there was a technique that was developed by a chiropractor years ago named Dr. Webster. And so he coined this Webster technique. And how it originally started was he was working alongside an OBGYN in his town. And he, whenever the OBGYN would identify that one of the babies was breech, so they were head up instead of head down, he would send them to the chiropractor, Dr. Webster, and he would do his adjustments and things on the pelvis and on the belly and the hips, and the babies would flip to head down. And so originally he developed the technique to help babies get into the optimal position leading up to labor and delivery. Over the years, things got a little messy with that because chiropractors were then saying they could flip babies, and it got a little messy with the scope of practice. And so ultimately, it became coined the Webster technique, not necessarily flipping babies, but working on the mom to optimize mom's body and the environment, which then would subsequently allow baby to move into a better position. We use it to help not only with any back pain, hip pain, pelvic pain during pregnancy, but also to really optimize that internal environment for the baby. And as I had mentioned earlier, the connection between the uterus and the sacrum. So the primary area that we're adjusting when doing the Webster technique is a lot of structures related and that attached to the sacrum. So basically how it would look is the assessment starts usually with mom laying face down. So we have pregnancy pillows with a belly cutout and a chest cutout, which is usually everyone's favorite part is getting to lay on their belly again.
Mhm.
And so we're assessing the sacrum for its mobility and its positioning, and then the piriformis and some of those hip muscles on either side, and then the sacrotuberous ligament, which attaches down by your sit bone. And so we're assessing those structures on the back of the body. And then when we have the patient roll over to face up, we assess the round ligament, which is on either side of the uterus and comes down into the pelvic soft tissue, and then the hip flexors and the pubic symphysis, the bones in the front of the pelvis. So the combination of working on symmetry and tension amongst those structures is what the treatment is based in with Webster technique, and is what allows for not only mom to feel better, but also for baby to find the best position possible. So the way that I like to also visualize it is if your foot is in your shoe and your shoelaces are really tight, it's going to be really hard to move your foot around or to get your foot out of your shoe. However, if you work on the loosening of the laces, opening up the top of the shoe, you're going to be able to move your foot around a lot more, and your foot's going to be able to come out of the shoe more seamlessly. So I visualize all those muscles and ligaments around the baby as like those shoelaces, and we want to make sure that those laces are not super tight and clenching them. They're able to have a little bit more pliability and just allow baby to move around more freely. So the sooner you can find a Webster certified chiropractor in your pregnancy, the better, because it's really tough when we get people calling in at 35, 36 weeks and they're like, help, my baby's breech. And we're like, okay, how long has baby been like that? And they're like, either I don't know or a long time. And by that point, baby has grown so much that there just may not be anatomical room for them to move. And so the sooner you can get in for treatment, the better. So that way, as baby's growing, your body is adapting, your body's getting treatment and hands-on care as all that is happening, to which will just help with the outcomes in the end. So
Yeah. Amazing. What a great analogy. I can totally visualize that. That makes sense.
right?
I love that.
It's
Yeah.
hard, like when you don't know what the pelvic anatomy looks like, to really understand how that could be helpful. But I like that analogy a lot. And I just think it's also important. Like some people are nervous to get adjusted when they're pregnant. And I think two things. First, it's important to be comfortable when you are going in. So if you're feeling uncomfortable about it, then it's probably not the right time to start, or you just haven't found a provider that can answer your questions or makes you feel safe and comfortable. But number two is like, you want to make sure that you're going in as soon as you do feel comfortable, and there's no timeline on that. It's like whenever you're ready. So I have patients in their first trimester. I have patients who come in their third trimester. It really just depends, like when they find out about it or when they want to start working on things. But yeah, it's important to feel comfortable and know that like we're never actually touching baby. We're working on the mom's body. And a lot of, what we can do during pregnancy is gentle and safe. And there aren't a lot of other options if you're having musculoskeletal pain when you're pregnant. So being able to at least find a Webster certified chiropractor to help you can be a game changer. I had somebody come in, oh my gosh, she had to get rolled in on an office chair because she could not walk. She had already been to her OB and her PT, and they were like, we don't know what to do for you. They're referring her to an orthopedist, and you're pregnant. I've got nothing for you. And so she got rolled into my office, and that was like one of the most severe cases I've ever seen. And I was able to help her. She walked out. Like everybody was just completely baffled, including me. I was like, wow, this is just so amazing that like the stuff that we can do can really have that profound of an effect. But yeah, she could not move. She was in so much, her back pain was so debilitating. And the only thing you can really do if you're comfortable with it is taking Tylenol. That's the only thing that's available, aside from other, obviously, like hands-on or acupuncture, PT, things like that. There really isn't much else that you can use to manage pain during pregnancy. So it's a great
Oh, that's
option.
amazing. Yeah. Even as you were describing it, the things that you're assessing, I'm like, oh yeah, because those are the things that most people have issues with, right? Like the SI joint pain, round
Yep.
ligament pain, pubic symphysis pain, the like lightning crotch. It's so nice that you're looking at that. And again, it makes sense to me looking at it from a preventative standpoint of, okay, let's do it earlier than later, get those things working really well. And so then maybe you're preventing all of those aches and pains that again are common, but not normal.
Yes.
So they can feel really good and ideally not even have to worry about a breech baby too.
Totally.
Because
Yeah.
they're
Then,
growing as you're doing these things.
yeah,
Yeah.
exactly.
And you mentioned like a Webster certified practitioner. Is there like a database or something where
There
you
is.
can find
Yeah.
them?
So if you just Google Webster certified, help me find a Webster certified chiropractor, the governing body that certifies people and teaches the technique has a website. And so anybody who has done the training and is a annual member of the a society that governs it will be listed on the website. So you can just type in your zip code and you can find someone near you. With that being said, I would still try to vet the person first, kind of get an idea of what their practice looks like, how much time they spend with people. Do they have an office where they do specialize in pregnancy, or do they just take the certification and just have it on their resume? So there's a difference between those two. So still vet the person, but that's at least a really good starting point.
Yeah, great. Wonderful. And then how about postpartum? Since we're walking through the
Yeah.
the transitions in postpartum, again, another huge shift in women's bodies, going from pregnant to suddenly not, and
Yeah.
all the hormone shifts that come along with that and everything. So what specifically can be done to help women postpartum?
I don't know about your experience, but like that 0 to 6 weeks period, you're just sent to the wolves, right? It's okay, see you back in 6 weeks. Like, no discussion of what changes you're going to feel, what things you can do to help yourself during that time period. So, chiropractic can really help bridge that gap. Whether it's you're starting to have the most common thing that I see in postpartum is neck pain and upper back pain, just because you're holding your baby, you're staring at your baby all the time. If you're breastfeeding, you're getting into all these awkward positions trying to hold the baby, or baby finally falls asleep on you and you're in like some weird position, lean back to the side position. So that really does a number on the musculoskeletal tissues of the upper body for sure. But the other big component to it is like what happens in your lower back and pelvis as your core has just gone through 10 months of stretching, and now it's working its way back to its new normal or new positioning. So we do still do adjustments in the postpartum period. So I would classify postpartum as like early postpartum, like that fourth trimester. And then also after that, truly, we're always postpartum. So whether you've had a hip issue that's been going on for quite some time and you're a year and a half postpartum, like to me, that's still postpartum because there's still so much change that's going on or that has gone on in your body. But that immediate postpartum period, we're looking at managing like the upper body pain, headaches, things like that. And then also just like recovering from the changes to the core and how that affects the pelvis. So in my practice, there are instances where I don't adjust the pelvis immediately afterwards, just depending on how somebody's feeling. And then there's other instances where it's okay, we really need to have that adjustment in that early period because that's really going to help kickstart all those structures to find their place again. So it's very specific to the person and also what type of birth they had. Did they have a vaginal birth? Did they have a C-section birth? How their healing is going, all that type of thing. So,
Yeah. Yeah, that sounds amazing. The head and neck thing, as you were saying that, I was like,
right.
oh, yes.
Even having a toddler, it's still, or like bigger kids, like they want to be held and lifted. And it's just so much on that area, so
Yeah,
much
so
load.
much. Yeah. So especially being able to get some relief from that, but also with your lens of knowing what their body has gone through and what positioning they're returning to
Yes.
constantly. That's so
Yes.
critical.
And like with a C-section birth, especially, like that's a major abdominal surgery and it's
Yeah.
not treated like that in our society right now, unfortunately. And so if you went in and had that procedure done when you weren't having a baby, they would tell you to not lift anything more than 5 pounds. They would tell you to lay down for most of the day. Those recommendations are going to be so different after having a C-section because now you have a little baby to care for and you've got to get to appointments and you've got to make bottles and you've got to feed yourself and do all these things. And so it's like, I just want women to know that there is things that can help support you during that time period. If you're really suffering, you don't have to be home alone, sad and in pain. There's a couple of amazing providers in my area that are pelvic PTs that will actually do home visits. So you don't have to leave your bed, you don't have to leave your house. So those options are available. Just have to find those people.
Yeah, definitely. Yeah, I had an emergency C-section and a planned C-section. And so my experience, I mean, they were both so different, but in healing from those and really, I was pushing myself too hard and
Of
then
course.
learning from that the hard way. It is a lot to take on. And for anyone who, no matter what kind of birth they have. So I think it
Yeah.
really is so important to know that they have resources, like you said, whether it be going into a chiropractor or getting someone who specializes in pelvic physical therapy to come to them or not, just knowing that they have the option, I think is
Yeah.
so important.
Yeah, I
So
think
it's
a lot
really
of it
cool.
is like really intimidating too, especially if it's something you've never felt before or it's your first baby. You're a fish out of water and you're trying to figure things out for your baby and you're maybe neglecting yourself a little bit until your body reminds you, okay, you can't neglect me anymore. You got
Mhm.
to take care of yourself. So just having someone even to dispel any fears or give you a little bit more understanding of what's going on in your body, I think that can be really empowering and really helpful, especially in that postpartum period where anxiety is usually quite high. There's just everything is shifting so drastically in such a short period of time that having a little bit more insight can be helpful.
Definitely.
Because
Yeah.
you're not going to be able to not hold your baby. You're not going to be able to not have to get up and use the restroom. So like these
Yes.
things you're going to have to keep doing. But if you can do it a little with a little bit less pain or a little bit more knowledge of how to do it to protect your back, for example, like how
Mhm.
should I bend to put my baby in their bassinet, or what's the best way to get in and out of bed when your abdominals are separated. These types of things can be really helpful.
Yeah, definitely. Yeah, I think one of my biggest learning experiences with my first pregnancy or postpartum with my first baby was what is my new normal? I think that was the hard part where I'd heard, oh, stay in bed. But then I was like, that doesn't feel realistic. Like you said, you have to get up, go to the bathroom, feed the baby. We had a 2-story house, so I had to like go
Yeah,
downstairs right
yeah.
away. And so I was like, that doesn't feel realistic. And I know my body. Like I thought I knew my body. I knew, like I felt great through my pregnancy. But then
Mhm.
all of a sudden postpartum, I was like, oh, this is something else that I was fine, but like I could have healed better probably. I probably could have prevented some of the aches and pains I ended up with. Yeah.
Yeah, I find a lot of times, like even for myself, immediately after birth, a lot of people get a lot of relief from any of the
Mhm.
like lower back and pelvic issues that they've had in many cases. And then it starts to creep back in once that activity level spikes up. So it's
Mhm.
okay, I'm feeling like I'm ready to go for a longer walk, or I'd love to go back to my strength workout classes and things like that. And that's really when those moments happen of, oh, my body is so different now.
Mhm.
And I thought I was ready, but maybe I wasn't. And what should I do? What's an appropriate path forward here to be able to gain strength without hurting yourself? So
Mhm.
it's a delicate balance. And I'm 6 months postpartum right now, or it's almost 7 actually with my second. And it continues to be humbling.
And that's with your experience too, like your
Yeah,
experience.
yeah. And like
That's a lot.
I'm constantly like teetering on this line of, should I go do that strength workout right now? Should I do some stretches on the floor? Should I just be walking? Like what's best for my body right now in this exact moment of my healing?
Yeah, yeah. It's great to go through that at least now, or to have that awareness now
Yeah.
to find what's right for your body rather than just pushing through. Because I feel like even beyond, like you said, we're always postpartum. And for so many women that I see, even they're going through menopause or like they're far out from being postpartum, and still their bodies are different than they used to be. And so it really is so important for us to listen to our body no matter
Yeah.
what phase we're in. So
I'll hear people be like, oh yeah, my hip was ruined ever since I had whatever baby number two or something like that. And they're 7 now or something, or they're 10. And I'm like, there's things we can do to help. You don't have to just accept that as your new reality.
yeah.
Of course, your body is not going to be what it was before, but that doesn't mean that it doesn't have to be in a negative way.
Yeah. Absolutely. Courtney, this was so helpful of a conversation. I think you gave us so many amazing takeaways from this conversation. I know you had some tips to share with the listeners also though. So if you want
Sure.
to share those now.
Yeah, so I was just trying to like reflect and think of what are some of the most impactful, simple things that you can do to help with your musculoskeletal system, just from a generic lens. And the first thing that came to mind for me is like learning how to breathe through your diaphragm, because the diaphragm is is a muscle. It's our primary breathing muscle. But oftentimes when we get into moments of stress or anxiety or that busyness of life, we don't use our full breath. We end up adapting and taking shorter breaths, breathing a little bit more through our neck and shoulders and not so much through our diaphragm and through our abdomen. So, learning how to breathe fully through your belly, through your diaphragm, can have a very profound effect on your nervous system, on your vagus nerve, and also on your ability to create core stabilization and core stability. That would be like my number one thing that comes to mind is like learning how to take a deep breath, not through your shoulders, but through your abdomen and through your belly. And there are instances where your muscles are so tight or your diaphragm hasn't moved like that in so long that it can be really challenging to actually feel like, okay, as I inhale, my abdomen's going to expand. And as I exhale, I'm just going to let that go. And the rib cage and the abdomen is going to go back to that starting position. So that would be number one. Number two is a lot of people in our modern world, we end up sitting a lot, driving, working, doing that type of thing. And I like to remind people that it's important to get up and move every like 45 minutes. So whether you get up and you just do some squats, whether you get up and get a glass of water, go to the restroom, just getting up and moving is going to be so helpful for so many reasons. But especially if you're experiencing lower back pain, please just get up and move around, change positions. If you have a standing desk, stand for 45 minutes, sit for 45 minutes, vary it up so that you don't end up doing the same thing for extended periods of time. And then the third thing that I'd love to talk about is just walking, how wonderfully therapeutic walking is for the spine and for the body. Whether you're able to go for 10 minutes, whether you're going for an hour for like a power walk workout, just knowing that like the actual mechanism of walking can be very therapeutic for the structures within your spine. So when we're walking, you want to let your arms swing. That kind of gets some rotation through your middle back. You want to allow yourself to try to breathe through your belly when you're walking, getting that. I like to kind of describe it as like a massage on your lower back when you're walking. This can be so helpful. So if I have patients who have disc herniations or having lower back pain, SI joint pain, walking is usually part of our treatment protocols. Get up and move. So I'd say those are the top three that come to mind.
Those are amazing. Those are so simple, like you said, but so epically important to think the way that we breathe. Oh my gosh, that's something that I learned too postpartum, that just the way that we engage our core, our pelvic floor, everything when we breathe. That's
Yeah.
important.
And it can have such a big impact, like you were discussing or talking about earlier, with like your sympathetic and parasympathetic nervous system, like just shifting and changing the way that you're breathing, like within minutes can have a profound effect.
Yeah.
There's been, I don't know the exact study, but I remember reading one where like they were testing heart rate variability and pre and post diaphragmatic breathing. And it's like within minutes, your heart rate can go down. You can report less stress, less anxiety, things like that. It's also helpful.
Yeah. Yeah. I'll tell people even just 2 breaths, like
Yeah.
two diaphragmatic, slow breaths in the middle of their day or wherever they can fit them in. There's really no excuse that any of us can have to not be able to just
Yeah.
breathe 2 breaths once in a while throughout their day. Yeah. Oh, that's so wonderful. So
Yeah.
helpful. Dr. Courtney, thank you so much. This was such a fun conversation. And I know that people are going to walk away with so much new education, so many things that can really help them, again, like through this huge transition of before and after, before, during, and after pregnancy. So wonderful. Where can people find you?
I'm not a huge social media girly, but I do have Instagram. It's Dr. Courtney Hays, Hays. There's no E there. And my practice is located in Irvine, California. So Southern California. That's where I see patients in person.
Awesome. And we'll link your information
Yeah, perfect.
in the notes too, so people can find you because you are a unicorn when it comes to the amazing ability, like the amazing things that can come out of chiropractic. Like you said, there's such a broad spectrum, but it's so incredible to have someone who has this lens to women's health. It's really taking this holistic view, and we have so much specific experience with, again, this epic change that our bodies are going through.
Yeah. Well, thank you for having me.
My pleasure.
It was fun.
All right.